Malaria, as one of the killer diseases, especially in children below the age of 5, will soon become a thing of the past thanks to a 5-year research carried out in 11 African sites, with Kenya having got 3 slots in Siaya, Kombewa and Kilifi.
Before we started this vaccine trial, we actually had a pre-vaccine trial. And basically what we were doing was seeing all the children who were admitted across at the district hospital and investigating them to find out what was really killing them and what was bringing them to the hospital and what was could potentially kill them. And what we found was actually very devastating. We found out that about 61% of our admissions were due to malaria.
At KEMRI's Walter Reed project in Kombewa, I talked to Dr. Walter Otieno, a senior pediatrician and principal investigator in the research project that is soon coming to an end. He says the result of the research that was meant to establish an amicable way of malaria control and treatment is amazing, stating that the RTSS vaccine will help save about 90% of deaths realized as a result of malaria.
At the moment, we now have a vaccine which will potentially prevent children from getting malaria. This is a vaccine which gives you about 53% protection if the children are followed for 1 year. It wanes a little bit if you follow the children for about 18 months. The protective efficacy goes to 46, especially in the older age group. But you see, if you consider that you can reduce the potential effect of malaria, and by potential effect, I mean sicknesses and eventually deaths, by about half, then this is very huge.
Of the 631 subjects of the research, 5 years down the line, they have lost only 3 to malaria. This, he says, is a huge achievement that when the use of the vaccine is implemented as they would recommend to the Ministry of Health, then deaths from malaria would be history.
For this particular vaccine, if you vaccinate 1,000 children and you follow them over a period of 18 months, then you prevent about 941 cases of malaria. And that is very, very huge.
Of every 1,000 children born in Kenya in a day, 200 die from malaria before their 5th birthday. This translates to 34,000 children dying from malaria every year.
If we say 34,000 children, basically what we are saying is that those are the ones which we are actually able to catch. But remember that in certain rural areas, a number of children still die at home because of they cannot access medical services. So when we say 34,000 children, this could just be the tip of the iceberg. We could be losing quite a number of children to malaria.
Malaria, which is rated 4th among the common diseases that takes children to hospital, kills a larger number of children in comparison.
In this particular region, malaria actually kills more children than any other diseases. And by any other diseases, if you talk about the 5 commonest, you are talking of malaria kills more than pneumonia, kills more than malnutrition, diarrheal diseases, other infections like HIV. Malaria is still the topmost priority.
The $500 million project is one of the successful projects of KEMRI, he says, and is optimistic that with the introduction of the malaria vaccine, Africa at large will have more healthy children growing while losing none to the disease. Lilian Atieno for KBC News, Kisumu County.